it's Andrea Tooley from AndreaTooley.com, and I just got back from work. That's why I'm wearing a suit. I had an awesome day in clinic today. I saw so many cool things, which I see cool things every day because ophthalmology is the best. But anyways, I'm here with you today to make a quick video answering a couple questions that I've been getting a lot on email. So I'm doing this kind of email Monday thing where every Monday I'm putting out a new video, and so that will either be an interview video with someone in the medical profession kind of telling you all about their aspect of medicine and what they do, or me answering a reader email or talking about some of these reader questions that I get all the time. So today, this is kind of a combination of 3 different questions that I get in emails from either blog readers or YouTube watchers all the time. And so those questions are, 1, how do you deal with stress and anxiety from being a pre-med or a medical student? The second question, 2, is how do you deal with self-doubts? People email me all the time and say, did you ever doubt yourself? Did you ever think that you wouldn't make it? How do you kind of deal with those types of feelings? And then the third question is kind of about test anxiety. And I talked a little bit about this in my how to study, one of my how to study videos, where I talk about test taking tips and how to deal with test anxiety. But I thought I'd talk a little bit more about kind of how to deal with all of those and what I've done throughout the years, and see if any of this might help you or work for you. And if you have any great tips to release stress or how you deal with anxiety from being a pre-med or medical student, or really anyone in the health profession, a nursing student or a physical therapy student, anything like that, I'd love to hear it. Leave your comments below, and yeah, let's get started. Okay, so the first thing I'll talk about is just anxiety in general. I think that in the pre-med and medical school community, it's very common to have anxiety because we are all very high-achieving, type A kind of people who have very high standards for ourselves. We all want to get the perfect grades, and we all want to be #1 in class, and you are just an achiever. And so you kind of have that level of anxiety built into your personality. If you're in this field, it's very likely. At least that's how it is for me. And so I think that that's a good thing, for one, because at least for me, having that low level of anxiety, just, you know, I have to do my best and I have to work hard all the time, has helped me achieve as much as I have in life, honestly, because without having that concern, then maybe you wouldn't push yourself as hard. I guess I don't really know, but for me, it's helped me work harder, study harder, and get to where I want to be because I kind of have this baseline anxiety. So if you're dealing with that, I would try to kind of embrace it and just think, you know, this is who I am as a person. I'm pushing myself to be better, and so this is a good thing, for one. Unless you're getting into that kind of crippling anxiety or really difficult fears where it's actually hindering your performance in life instead of making you higher performing. And if you're getting to the point where you're actually having difficulty with just functioning in life in general, then I think that that's taking it to a different level, and maybe these tips in this video aren't 100% for you. If you really feel like your life is being hindered by anxiety, or you have this kind of crippling fear and you can't live a normal life, then that's time to go get help and see somebody and talk to somebody about it, because once it starts interfering with your life and changing how you're performing, then it's a problem and needs to be professionally addressed outside of YouTube. So please get help. Please take care of yourself if you're having those kind of anxieties. But if you're just having those normal pre-med anxieties, so one, kind of try to embrace them. And then one thing that really helped me deal with anxiety is to just kind of like stay on top of things. And so you're gonna be anxious, you're going to have fears, but if you know that you're doing what you're supposed to be doing, to get to your next goal, then you're gonna feel better about things. So this is actually a tip that I keep meaning to say in different videos and then I never do. But this is something that I have done throughout all of my schooling, high school, college, medical school, and even residency. And that is that I always find someone who's 1 or 2 years ahead of me, and then I ask them everything about what I need to know. So when I was in college, when I was a freshman, I would like find sophomores who had or were pre-med, and I would say, can I meet with you for coffee and ask you all about these classes? And I would get all of their advice. And same thing in medical school. I had a mentor in medical school who was 1 year ahead of me, and every semester, all through medical school until she graduated and left me. Jamie, why did you leave me? No, every single semester I would meet with her and ask her everything. And I wanted her advice. I wanted to know what the classes were like. I wanted to know how to study for them. I wanted to have her old textbooks, and I wanted to have her advice, and I wanted to know. And so if you have anxiety, then I think knowledge is helpful and peaceful, at least for me. Knowing what to expect and feeling prepared is huge for helping me when I'm feeling anxious about my classes or the semester, or the course load or whatever. If I can talk to somebody and they say, this class can be really hard, that's what you should expect, but these are great ways to do well in it, then I'm gonna feel automatically better, okay? So that's one thing, just kind of in school, when you're studying, find people who can help you, who can tell you what you need to know. That's gonna be very helpful. At least it was for me, okay? And then anxiety in the clinical setting. People ask me, you know, do you feel really nervous when you're seeing patients? Or I recently got an email and someone said, do you ever worry that you've made a mistake and prescribed the wrong dosage of medication or things like that? And so, sometimes I think that you definitely, when you're new in medicine, so when you're a med student and you're getting new clinical responsibilities, and then when you're an intern and you're finally a doctor and you have things to do, you're always going to feel nervous about what you're doing. But most, at least at Mayo, but I think most programs everywhere, all medical schools and residencies, you're gonna have so much support and so much backup. There are senior residents checking your orders, there's pharmacists checking your orders, there's a whole team, you're never alone. And so I never worried that I was prescribing the wrong dose of medication, or I never worried that I was forgetting an order or something like that. Because I knew that people had my back and that I wasn't flying solo. I think that if you're having those fears, and that's good, because you're being diligent and you're not just being flippant about whoever you're seeing. And so when you have those anxieties, just go back and check what you did, make sure you did it right. And then, you know, I did everything I was supposed to do. There wasn't anything else I was supposed to do that I didn't. And so we're good. And sometimes you just have to trust in your knowledge and your clinical judgment. And the best thing you can do is ask questions and ask for help. That is the 100% best thing you can do. I always ask everybody to double check what I'm doing. Even if I don't have a senior or an upper level see the patient that I'm seeing, and this was during intern year, I say, hey, by the way, I did this, just letting you know, so that somebody else knows what I'm doing, and that always made me feel better. And so I think kind of working as a team, trusting those around you, knowing that you have support is gonna help you when you have anxiety in clinical situations. So that's another thing. And then in terms of having anxiety with professors, or having anxiety public speaking, or being in a group setting or with a team, that's going to be really dependent on who you are as a person. You know, some people are very talkative and very outgoing. I'm very outspoken and I just say whatever and I don't worry about it. And other people are more quiet and reserved. And so I think that medicine is a very supportive community. And even if you are a very quiet and reserved person, then you're still appreciated and you're still acknowledged and you're still just as much part of the team as somebody who's very boisterous and talkative all the time. And so you don't need to worry about speaking up in the group. You're gonna have your patients and speak for your patients, and also having anxiety speaking in front of attendings or consultants. Everybody does. I totally did. I would get so nervous talking in front of some of the consultants. And you just have to remember that in medicine, in this journey, there's thousands of doctors, and we have all gone through medical school, and everyone has been where you are right now. Everyone has been an undergrad, and everyone who is a doctor has gone through medical school and has had to talk in front of attendings for the first time and had to see patients alone for the first time. And so you just have to tell yourself, if all of these other people can do it, then I can do it too. Why wouldn't I be able to do it? There's no reason why you wouldn't be able to just as well as anybody else. So a lot of it's just kind of reassuring yourself and reminding yourself that everything you're feeling and experiencing is totally normal, and there's no need to be anxious about it. And if you are, then just keep practicing, and you'll calm down with time, and it'll get better and it'll get easier with time. So those are some good strategies for kind of dealing with anxiety, fears, and self-doubts clinically. And then for people who ask me questions, did I ever doubt myself? Meaning, like, did I ever think I wouldn't make it to medical school? And I wish I had a better answer for this, but kind of no. I really felt confident that I would be a physician. I really thought that I would make it, and I knew that this was what I was going to do. And when I was applying to medical school in my senior year of college, I was definitely nervous, and I was definitely afraid that I was not going to be accepted. And my plan was that if I didn't get accepted, I would do graduate program for 1 year and reapply. And that was my plan. And I had no other backup plan, because I felt like I was going to get in. I felt like I was a pretty competitive applicant. But if I didn't, I was just going to keep applying, and that's all there was to it. And so I didn't doubt myself. I could picture myself as a doctor. I could see myself with patients. It was just what I knew I wanted to do. And there was nothing else that I wanted to do with my life. And I think that if you can see yourself in a different career and see yourself really happy in a different career besides medicine, and then you're getting all this anxiety and all this self-doubt about medicine, then you should really think whether or not it's the right career for you. If you are having lots of self-doubts, but at the end of the day, you can only see yourself being a doctor, and you know that that is the only career that you will be happy having, then you just have to throw those self-doubts away, and you just have to keep marching forward. And it might be a long journey. There's people who apply to medical school multiple times, and you just have to keep pushing forward, because if it's what you want to do, then it's going to be worth it. If it's ultimately the career of your dreams and what you're passionate about, then it's going to be worth it. And you just have to keep reminding yourself that. And when self-doubt and fears and anxiety get in the way, kind of take a step back, look at everything, look at where you are, how far you've come, and remind yourself that you just have to keep going, and the journey is worth it. The pre-med journey is really arduous and long, but it's really wonderful too, because every step of the way is so different. I always think about how being a med student is so different than being a resident, and being a resident is nothing like being an attending. Maybe in some specialties, but in most specialties, your days as a resident are not at all like what they'll be when you're a consultant or an attending. And so every little chunk of this journey is just its own unique, special experience that you'll never have again. And even though it's hard and it's long, it's such a privilege, and it's really incredible and totally, totally worth it. So tell yourself that whenever you're feeling those self-doubts. And then about test taking anxiety, I kind of use a lot of the same concepts that I've been talking about here. Reassurance. I tell myself that I have studied as much as I was able to, and that whatever will be, and whatever grade I'm gonna get is whatever grade I'm gonna get, and there's no other way around it. And I take my time before a test. I like to study for a couple hours before a test. I always, in medical school, would get to school really early. If my exam was at 8, I would get to school at like 4 in the morning and study until like 7, and then take a break, get some coffee, hang out with my friends, and then my friends would all start showing up before the exam, and we'd like quiz each other a little bit, and then at like 7:30 I'd be done, and I would just socialize for a little bit before the test. But having those couple hours to study before really helped me with test taking anxiety, because I had just looked over everything. So like going into a test cold for me, so going to sleep, waking up, and then going in right to take the test, I would have a ton of anxiety, because it'd be like, did I remember? Did I forget? Like, I've gone to sleep, I don't know. And so that's why I really like to do a bunch of studying, at least an hour or 2 or more before a test in the morning. And that was huge for my anxiety, because I would go into the test thinking, I just looked at everything and I know it all. Or I just looked at everything and there's only one thing that I really feel weak on, and so I just looked at that 10 minutes ago, and that's all, I hope I remember it. And so that's it. So that was huge for my anxiety. And then if you watch that test taking tip video, other things that I do for anxiety during tests, I have this certain way that I take tests. I take a break, I go to the bathroom, I kind of like take some deep breaths and chill out halfway in the middle of the test, and then I go back and I finish the rest, and that really helps me with anxiety. And those are kind of my biggest tips. And we're all crazy people, and we're all working so hard and trying so hard, and this is a tough journey. And I can't tell you how many days I've just cried and called my mom or cried to my husband, especially in medical school. Medical school is rough, man. It's just all really tough on you mentally. And so having these feelings, having these anxieties and fears and self-doubts are totally normal, and you get through them. You have good days, you have bad days, you have days when you think, man, I am awesome, I got the diagnosis and I did everything right. And then you have other days, like yesterday in the clinic, I couldn't see anything on my slit lamp exam. It was like the worst day ever, and I just couldn't see anything. And so sometimes you have those days where it's just like, man, I was not very good, I was not on my game today. And you just have to let it go and remember that all these doctors that have come before you have had the exact same experiences. And so we're all in it together. Don't doubt yourself. You can do it. If you see yourself as a physician, then you will be a physician. Just keep plugging forward, okay? And I hope this helps. I hope you like it. Let me know what your strategies are for any of these things. Leave your comments down below. Check out my blog, andreatuley.com. New videos every Monday, so subscribe to the channel so that you don't miss a video. And I will talk to you later. Bye.